Today is Sunday, May 5th, 2019, and welcome to my PCD life. So I'm going to talk about the procedure I had on Friday, but before I do that, a little bit of a disclaimer. I just want to make it clear that, these are my experiences with the tests, and I'm doing it just, for people who are going through this process or the family members, so you kind of have an idea of what to expect. And I also get that some people want to be blissfully ignorant ahead of time. They don't want to know. It might scare them knowing ahead of time. And my sister is one of those. She said that, she would not want to see any of this ahead of her. She had a lung transplant 5 years ago. So, and also that different centers may do things a little bit differently. So, again, just, don't want you to think that everything I'm having done are the only tests that might be done. It's, I think it also depends on a person's age and the person's disease. Friday's procedure was a right and left heart cath. So if you're a little more squeamish, maybe this may not be a video that you want to watch. You're not going to see any of the procedure, but the description, it was a more invasive procedure. I was awake for it, and what they did, this one they I had to wear a gown for, and take everything off, put on the gown. They gave me a Valium, a Benadryl, and an aspirin beforehand. And so wheeled into the procedure room, lying flat on my back and turning my head this way. So and I'm going to get these mixed up. So I think for the right side of the heart, they go in through the vein. And for me, they went in through the neck. You can see the Band-Aid still. And so this was with my head to the side. They put a cloth on, and I had an IV. And they gave me a little bit of, I guess it gets called twilight. I didn't feel out of it. I will say the room started to kind of melt a little bit for about 5 minutes. But, I felt still there. I could hear everybody talking. So if you've ever had a PICC line, that's sort of what this procedure is like. So they gave me a shot of lidocaine to numb the area. And then they go into the vein and they feed that into the heart. And they had a camera that they, were able to do some pictures and whatever else. So I couldn't see any of that. With my head turned to the side, they had a cloth completely over. So I really only had this much of a view from the side. For those of you who are like me, PCD patients or cystic fibrosis, bronchiectasis where you're coughing a lot. My husband did some respiratory therapy on me before they wheeled me back, so that helped to clear out my airways a bit. And then they gave me a suction thing to, just suction so I'm not working real hard to move everything out. And that worked out great. So I just laid like this and suctioned whenever I had to cough stuff up. Then they go into an artery for I believe the left side of the heart. And they do it at the wrist. Well, they did mine at the wrist. The one other possibility is they go through the leg, the groin, and feed up that way. But apparently that's sort of older school, but it can depend on the doctor. And it also depends if they can't get the artery in the wrist, then they don't have a choice but to go up through the groin. So luckily, they were able to finally get it in the wrist. They, again, gave a shot of lidocaine, and they weren't in the artery the first time. So, they say you're going to feel a little bit of pressure, but it was a little, definitely not excruciating, but, I just felt a little bit of pain, and I knew that wasn't feeding properly. So I let them know, and they, tried again. They were able to get it. So fed that up, and again, did what they needed to do. I think they used some dye I guess to help with the pictures. Then when that was all done, they wheeled me back out into, the recovery area. So again, awake the whole time, but with the Valium, a little bit of whatever they gave me right before they started, the Novocaine, don't really feel much of it, and certainly didn't feel anxious during, or that anxious during the test itself. So you'll see some pictures that I took like post-op, after this segment of the video, and so they have like a tight tourniquet on the wrist, and I was in a splint, so you'll see a picture of the splint, and you'll see when I first came out it was pretty tight, so my hand's almost purple looking, and they start backing off on the pressure, but you certainly don't want to have an artery bleeding, and so I had to wait, as they backed off the pressure for about an hour, hour and a half, just to make sure that everything was good. And then they put my arm in a splint. Couldn't bend my wrist for 24 hours, and I still can't lift for another 24. So 48 to 72 hours total, no lifting with the hand used. There's two more things that I wanted to add to this video. So the first was just a little more information, a little personal about the procedure on Friday. And when I heard that they were going to go in through my neck, my one concern was coughing. So, coughing, you can kind of see how the muscles tighten up in the neck area. So if they're working in there, I wasn't sure how well that would go with coughing. And I knew I wasn't going to be the first person that this was an issue for, but how would they handle it? And so when I asked the doctor, he said since I wasn't like having coughing a lot while he was telling me about the procedure, that he wasn't too concerned. And so he just, when I needed to cough, I let them know. And, sometimes they were like, okay, that's fine. Others, they were like, okay, well, if you can hold on for a minute or cough now, and then we'll start. So the other thing with the coughing is, I had some pressure, big tape, which you can see from the picture after the procedure, and they had a bandage over, to keep pressure on it. So coughing against that hurt, I mean, not like painful, but just almost like with a bruise. So just, some discomfort, just to be aware of. Now the other part, so I have some suggestions if, you're going through these procedures. For the right-left heart catheterization process, you may not know if they're going to go in through the arm, the wrist, for the artery, or through the leg. But my suggestion since I had the wrist one, having the splint on, I couldn't bend my wrist. So having loose clothing, something that's not real tight around the wrist, that can stretch a little to go underneath the splint, the wrapping, would be handy for when you leave. So that's men and women. Now the next part of the advice is more for women. Well, it is for women because it has to do with wearing bras for the procedures. The days 2, 3, and 4, I wore a sports bra that was just elastic, no metal anywhere. So I didn't have to change into a gown for the CT scan, for the DEXA, for the X-ray. Good to go with those. Now, for the heart catheterization, the sports bra was not my friend that day. It just, for those of us who have struggled getting in and out of them before, I would have worn just one of my clip in the back bras, not like a total clip, not like a sports bra over the head that then clips in the back, but you know, where you pull it up your shoulders and then clip it in the back. That probably would have been the more comfortable choice after the procedure, the heart catheterization, because I couldn't bend my wrist and I didn't feel like struggling to put the bra on, or getting help with that type of bra. So just a few suggestions to think about if you're going through this process. So thank you for tuning in to this episode of My PCD Life. I have a few follow-up appointments this week. Well, part of the process appointments this week, and then my follow-up with the transplant pulmonologist is on May 15th. And my plan, I probably won't do any videos again until after the May 15th appointment.